businesses. Joining me now is the governor of Maryland, Larry Hogan. Governor Hogan, thanks very much for being with us. I really appreciate it. I want to start with what you have announced in Maryland, which is the closing of all non-essential businesses. You haven't issued exactly a stay-at-home order, so I'm curious what you see as the difference there.
Well, really, it's basically, John, it's semantics about how you define it. But we've closed more businesses than many of the states that have stay-at-home orders. It's like we've encouraged and suggested that everybody that doesn't need to go out, that isn't an essential business, that they do stay home. We're very strictly enforcing the limitations on social distancing of no groups of 10 or more. And we've closed more businesses than anything that's not essential. So it has the same effect. Some of the people have said they issued stay-at-home orders, but they still have all these businesses open, and they have the exceptions for them to go to all those businesses. We're all taking different steps based on what we think is right for our states, but we've been about as aggressive as anyone in the country. One of the first states to declare a state of emergency, one of the first states to close all the schools, and then we closed all the bars and restaurants, and this is another further step. So these are all things that you've been talking about to try to bend this curve downward and to stop this overflow crush on our healthcare system. I'm going out today with the National Guard to stand up a 250-bed hospital in the Baltimore Convention Center to try to help with this surge, and we're all fighting it this thing as best we can from all directions.
It was striking, though, that yesterday you announced the strictest orders in your state yet, the closing of all non-essential businesses. You're just starting that now, while the president, for the first time, was talking about relaxing some of the social distancing guidelines around the country. So how do those two things match?
Well, they don't really match. Quite frankly, some of the messaging is pretty confusing, and I think it's not just it doesn't match with what we're doing here in Maryland. Some of the messaging coming out of the administration doesn't match. Where you had the Surgeon General and Anthony Fauci saying things that were almost completely opposite of that yesterday. So we're just trying to take the best advice we can from the scientists and all the experts and making the decisions that we believe are necessary for our states. We don't think that we're going to be in any way ready to be out of this in 5 or 6 days or so, or whenever this 15 days is up from the time that they started this imaginary clock. Most people think that we're weeks away from the peak, if not months, and that's what the advice we're getting from the smart folks at Johns Hopkins and NIH and University of Maryland and places like that.
Yeah, Johns Hopkins literally overcame the Spanish flu or the flu in 1918. They're good people to listen to down there. Given the variance in messages, the different messaging coming from the administration, coming from you, coming from public health officials, which message do you want the people of Maryland to listen to?
Well, I want the people of Maryland to continue to pay as much attention as possible. We want them to listen to us, and we've been very strongly telling them that unless you have an essential reason for leaving your home, we want you to stay in your home. We are closing all of those businesses that are not absolutely essential. We've closed the schools, and we think it's absolutely critical that everyone be a part of this breaking the back of this virus so we don't infect hundreds of thousands more people in our state and we don't have thousands of deaths. We just had a big spike in the past week. We're up about 600% over the week before. And there's no time, we're going up, we're not going down. And this is not over by any stretch of the imagination. And we need everybody at the federal, state, and local level of government, the private sector, and every individual to help us fight this battle.
The state of Virginia, your neighbor, announced closing its schools for the rest of the school year. You were one of the first states to close schools at all. Do you envision perhaps having to announce soon that they'll be closed for the rest of the school year?
So we were on a call yesterday with Governor Northam and Mayor Bowser in the District of Columbia, and we're all talking about those types of things. We have been meeting with all of our local school superintendents, with our state superintendent of schools for the past several weeks. We said over the 2-week period we were closed, we were going to do an assessment, and we should, over the next couple of days, have some decision about that. Basically, we're trying to make the decision on the health needs and saving the lives of children and stopping the spread, but also figuring out how we make sure we can educate those kids remotely and online and with take-home work for the younger kids. So it's we want to make sure we do everything right and make the right decisions, but that should be coming shortly.
Everyone can see the economic impact of this all around them at every minute, right? People are losing jobs. We all know people who've lost their paychecks. But how do you balance that with the need for public health and to save lives? How do you put a value on this effort to save lives?
Well, John, that's the hardest part, and that's yesterday and almost every day we've taken unprecedented action in two ways. To one, on the health front, and two, to try to mitigate the damage on the economic front. Yesterday, while announcing the closing of non-essential businesses, we also rolled out a whole series of economic things to help at the state level while we're waiting for the federal assistance. The good news is that they have a couple of stimulus packages that are going to get some checks in the hands of people that need it, that are helping on unemployment, that are helping to put some more money back in the economy. But the latest one is stalled in Congress. With partisan bickering. We've got to get the Republicans and Democrats working together to get this done for the American people. But in the meantime, in the states, we're taking our own actions. We've put together programs to help the small businesses, help those workers that are losing their jobs. Because you can't make the decision one versus the other. Do we let people die, or do we kill all the businesses and jobs? It's a twin battle that we've got to be fighting them both at the exact same time, and that's exactly what we're trying to do here.
We wish you the best of luck in that battle going forward.
Yes.
Governor Larry Hogan of Maryland, thanks so much for being with us. Please keep